Amid a bumpy rollout in recent weeks, more Americans are now eligible to get a COVID-19 vaccine in many states. So how can you navigate the process? Bob Woodruff has the answer in this week's Vaccine Watch.
Amidst the chaos, COVID cases have surged to new heights. In the search for potentially life-saving vaccines, Americans have met long lines, broken websites, and confusion.
I've been on the computer since 8 o'clock last night and can't get an appointment anyplace.
So far, nearly 30 million doses have been sent to the states, but only 10 million first doses injected into people's arms.
How do you feel when you see these frustrations from people who say they just can't get a vaccine?
It's devastating. We have the greatest scientific achievement of our lifetimes in the development of this vaccine, and then all of a sudden, we can't get it to people.
Some now pointing to potential faults in the current distribution method.
So if you go into a facility today, you get your first dose, your second dose is earmarked for you.
To address the slow rollout, the Trump administration this week says it'll release all doses to states rather than reserving the second dose, with hopes that by the time you're due for that second required dose, there will be more in stock. While many support the move,
this is, first of all, a really good move on Secretary Azar's part.
Some experts say vaccine supply is not the only problem.
I don't think flooding the market with a lot more vaccine is necessarily going to solve some of these problems.
When you have hundreds and thousands of patients trying to get in queue and register and ensure that you have enough supply, you really hit a bottleneck.
That bottleneck is also at clinics, pharmacies, and local health departments, often understaffed and potentially underfunded, now tasked with getting these vaccines out into the community.
It's not surprising that there's going to be challenges in that rollout, especially as we're relying on the same people that are already spread so incredibly thin and underfunded.
It's really the lack of information that is the primary pain point that we see across our care centers.
Now, tech companies are stepping in to try to help local health departments, hospitals, and pharmacies cope with massive demand for these vaccines.
We've launched Care Scheduler, which is essentially, it allows patients to log in, enroll themselves into a time slot that the pharmacy has available.
But even these tech companies admit the online approach will be challenging for the nation's elderly or people with limited computer access.
It's hard to imagine, my 95-year-old grandmother getting on a website, trying to find a link.
My parents reached out to me. They said, what do I do? Where do I start?
So these have been the problems. Let's talk about what some of the solutions might be.
Public health is not known for its tech deployments. And so working with, companies that know how to build digital tools, especially in the booking and appointment arenas, right? Like Eventbrite or SurveyMonkey or companies like Google and Apple, they are all prioritizing vaccine uptake as one of their real sort of corporate efforts.
So my father wants to find out if he can get a vaccine. What does he do?
There is no single tool that will provide that to your parent.
So it's every state is different.
Every state is different.
For those trying to navigate the process, these tech experts recommended a few simple steps. Once online, your first step is your local public health department website. There, you should be able to see if you are eligible for the vaccine based on your community's prioritization schedule. Second stop, booking an appointment. You might be able to do this from your health department website or a third-party website like ZocDoc, or there may even be a phone hotline. If you manage to schedule an appointment, show up at the scheduled time, but there could be a wait. The incoming Biden administration has promised 100 million injections in the first 100 days in office, hastened by a growing number of mass vaccination centers and delivery of more doses every day.
There's only one holdup in the vaccines, and that is the vaccines we're getting from Washington, D.C. That's just fine. But we're providing by the time we get to the end of this week, it's going to be about 750,000 per week.
And hoping to streamline this process with other online tools.
We run a platform called Vaccine Finder, which is a government resource at the federal level that will go live in the coming weeks to allow people to figure out where they can go to get vaccines in their communities.
And companies like EnlivenHealth are working on a more proactive outreach that will remind people when it's their turn to sign up.
So essentially, they all get a text message from XYZ Pharmacy saying, it's your turn, essentially, to enroll. and here are time slots that are available. Please enroll. So it's more of a proactive outreach versus a reactive.
I would say if you have the ability to hang tight, try to keep doing the basic non-pharmaceutical interventions, I think we're going to see, in the coming weeks, months, a real change in the way that we're getting vaccines out to people. So not to lose hope at this point.
This is Bob Woodruff, tracking the vaccine.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.